The coronavirus pandemic is a public health and policy challenge unlike anything we've seen in our lifetimes. People want information about it. One of the biggest mistakes you could make as a reporter of that information would be to politicize the coronavirus. Unfortunately, it's too late. National headlines, countless opinion pieces, and pundits have already arbitrarily been tearing into particular states. People there will die, many say. These leaders are killing people.
That's how you kill people in this country.
With so much criticism of various states being thrown around based on clickbaity projections and on takeaways that only serve to confirm prior political biases, I thought it would be helpful to conduct a data-driven analysis that focuses on comparing coronavirus deaths across different states. From there, we can backpedal into the policies and underlying factors that have led to the fight against COVID-19 being successful in some areas and unsuccessful in others. In this video, I'm going to analyze how statewide COVID-19 deaths are associated with these three factors. Hopefully, this helps us depoliticize the coronavirus crisis and deflate any and all biased and agenda-driven media narratives. On an individual level, we definitively know that COVID-19 is massively more lethal if it is contracted by an older person, including an obscenely high death rate for those aged 80+, and a nearly invisible death rate for those under 25. As a result, you might think that states with older populations have experienced more deaths than others. They are, after all, at a disadvantage. But my analysis instead found that the strength of correlation between COVID-19 deaths and the median age of a state's population is infinitesimal. R-squared is a measurement of the strength of correlation between two variables, with 0 being no strength and 1 being perfect correlation. 0.02 is about as close to no correlation as you can get. Here's what this information looks like in bar chart form. Another thing we know about coronavirus is that, like any disease, it spreads more easily when people are in close proximity. Naturally, just like with age, you would think that states that are more densely populated have a structural disadvantage and must be suffering disproportionately. I was surprised to find that the strength of correlation between COVID-19 deaths and a state's number of people per square mile is also very weak. But it isn't non-existent. There is a visible trend that denser states have been harder hit, but by widely varying amounts. Let me emphasize that these weak and non-existent correlations don't mean that coronavirus doesn't target the elderly, or that it doesn't spread more rapidly when people are closer together. It simply means that it appears that other factors are the driving force of COVID-19 deaths on a statewide basis. Next, let's look at political control of state governments. The media has been too common to report, and many people have been too gleeful to share on social media. Narratives of death in Florida. Georgia is experimenting with human sacrifice. Predictions of carnage. People will die here. Not many have died there yet, but they will, trust us. Arizona is irresponsible. Missouri is doing this wrong. South Dakota, population 12 people, has the nation's biggest hotspot. Republican states are where people will die. Conservatives are causing chaos. We're going to bash your state unless you implement policies we approve of. Republicans equal death. Republicans equal death. How could you do this? People will die. Sadly, too many in the national media seem to think that political control of a state is what determines whether people are living or dying from COVID-19. To avoid any risk of personal bias, I separated states into three main categories of local control: blue, purple, and red. These categories were determined by the three main types of routinely elected state leadership: governors, state houses, and state senates. If Democrats control all three in a state, I labeled it a blue state for purposes of state government control. If all three are Republican-controlled, I called it a red state. Any mixture of state party control, and I deemed it a purple state. This adds up to 15 blue states plus DC, 13 purple states, and 22 red states. Now, with every state categorized, we can look at the data. My guess was that political control would not correlate very well with COVID-19 deaths per 100,000 people. In fact, I guessed it would be the weakest of these three variables. But I was dead wrong. In fact, the strongest correlation with COVID-19 deaths of these variables is political control of state governments. it looked like this. Oh man. Depoliticizing coronavirus might be harder than I thought. As of June 20th, the average COVID-19 deaths per 100,000 population in blue or Democrat-controlled states is nearly 400% higher than the deaths in red or Republican-controlled states. This is not a prediction or an accusation. This is a fact as of today. Maybe it will change. In fact, I expect it to. But worse-off states can't just blame having older citizens or a denser population. Policy differences are clearly at play. But simple bar charts don't tell the whole story. Any statistician could tell you that. The takeaway of my analysis is not that blue states currently have worse policies for preventing COVID-19 deaths than red states. That would be a terrible summary. Let's focus back in at the scatterplot of the underlying data. As you can see, most states, red or blue, have done a fine job limiting deaths. States as liberal as California and as conservative as Arkansas are doing quite well. So here are two much better takeaways from the analysis. Number one, there is no red state that has yet suffered a catastrophic statewide outbreak. Their policies, generally speaking, have been working for them. In fact, as of today, not a single red state has a death rate materially above the national average for the United States as a whole, and most are far below. One red state, Indiana, is in a statistical tie with the national average. But clearly any media pundits who are berating Republican policies as deathly experiments are just doing something slimy. Florida, for example, has done not only well against coronavirus, but outstandingly well, especially considering that its population is both one of the oldest and the densest, and thus one of the most vulnerable in the entire US. Governor DeSantis' policies that focus state resources on protecting nursing homes appear to be top rate. And number two, specific blue states have completely failed at fighting COVID-19. Again, most have done well. Some examples of impressive blue states might include Oregon, which is geographically very close to the US's first confirmed coronavirus death in Kirkland, Washington back in February, and Maine, which has the oldest median age in the US. The obvious failures, on the other hand, include places like New York, New Jersey, Connecticut, Rhode Island, DC, and Illinois, all of which have been absolute coronavirus catastrophes. A dark recipe of policy disasters appear to have contributed to thousands of deaths in these states. Based on all this, a news story that is informative to the public might say something like, New York State is an absolute disaster for coronavirus deaths. Here's what we believe its leaders have done wrong. It could also drill down to the worst part of New York State, New York City. The reporters on the story should ask questions like, why did New York City wait 2 months to shut down and sanitize its poorly ventilated, close proximity subway system? Why did the state wait until late March, the 22nd to be precise, to implement a stay-at-home order despite the severity of the local outbreak and the structural risk in its dense population? Above all, why did New York Governor Cuomo issue an order mandating that nursing homes open their doors for infected patients, directly exposing their extremely vulnerable elderly residents to COVID-19? Families across the country were, reasonably, banned from coming inside of nursing homes to visit their loved ones due to the risk of coronavirus spreading. This was CMS, aka federal government, policy as of March 13th. But in New York, Governor Cuomo on March 25th specifically ordered that people known to have the disease be brought inside of nursing homes for treatment. Why would he do that? I don't know the answers to these questions. These are questions for responsible reporters to ask of those in charge of COVID policymaking. In the end, whether you're a media pundit or not, if you're going to criticize a state for its policies that you say cause coronavirus deaths, don't base your critique solely off of wild projections that have little relationship to reality. Base your critique on where deaths have happened and on what policies and situations led to those deaths. It makes no sense to say that blue states are killing people. It makes even less sense to say that red states are killing people. COVID-19 is killing people, and it is enabled by health factors, by demographic disadvantages, and yes, by specific policies enacted or not enacted by specific leaders across the US and the rest of the world.